Hi, one of the more common questions I get asked during a consultation for breast augmentation is what is the difference between a silicone and a saline breast implant, and is one better than another or safer than another? So here we have two implants. They look the same, but this one is saline, meaning filled with salt water. This one is silicone, filled with a semi-gel silicone. The outside of these is the same material, and this particular implant is a smooth, round implant. So, what are the differences? Well, the main difference between the two is in the way it feels. There's really no significant difference or no noticeable difference in the average patient in the way the implant looks when they're using either one of these for breast augmentation. And the main difference is in the way it feels. So when doing a breast augmentation, the implant needs to go under the chest muscle. There's no good reason to put it on top of the muscle unless specifically requested by the patient. Going under the muscle gives nice tissue coverage to the implant to minimize the palpability of each implant. And that's the main difference between the two implants. The saline implant placed under the muscle covers the ripples that you see on the front of both of these implants, these ridges. The muscle covers the upper, let's say, 2/3 of the implant, so those aren't visible. But the saline implant has ripples around the edge. This is the gel, and I can show you the ripples. And the saline implant has those, the silicone really doesn't. And the main difference between the two is in how they feel, and the fact that you can feel the edge of the saline implant along the bottom of the breast and sometimes on the side. In a patient with an average amount of breast tissue, let's say a small B maybe, who is not going very large, then the palpability of the breast implant becomes less noticeable. And in a very thin patient going with a large breast implant, it becomes more noticeable. So when you compare the two, if this one is more natural in the fact that it is less palpable and more natural feeling, why doesn't everybody want a silicone implant? Well, the bottom line is the silicone gel implant just costs more to buy than the saline implant. The procedure itself doesn't cost any more, but the gel implant is more expensive. And in the long run, it's a little more complicated. So one of the most important things for a patient to know when they're having a breast augmentation is someday they have to repeat the procedure. These do not last forever, but they do last for much longer than 10 years. So there's no truth to the statement that the implant has to be replaced every 10 years. You only replace it when it pops. And at some point in your life it will. So what happens when that pops? There's a scar that forms around the implant, keeping the material within the scar. So when the saline pops, you absorb that fluid, the breast begins to shrink and you see it happening. When the gel implant pops, the gel that's in here begins to slowly leak out, and that causes the scar that's around the implant to become thicker. So let's say a woman has this implant for many, many years and it has popped. She would notice that the implant is much harder because the shell or the scar is squeezing on it. And so more than likely, let's say it pops 10, 12, 15 years from now, you're not going to come in and tell me my implant has popped. You're going to want to know why it has become hard. So at that point, if that was to happen today, the recommendation is to go get an MRI. That's the main difference. If the saline pops, it gets flat, you can see it happens. If the silicone pops, it's hardened, and we want to know why, and so we have you get an MRI, and there's a little added expense. There's no difference in the safety between the two. Saline is basically salt water like your sweat, and the gel that leaks out of here is very thick like rubber cement, and it stays within the pocket, so it does not travel through you. So if you want the most natural result in all aspects, meaning the way it looks and the way it feels, the gel is the way you need to go. But if you want to save some money and aren't affected or don't have a problem with the palpability of the implant, saline is a very viable option.